Remember to subscribe and hit the bell icon to never miss an update from iMumz.
Hi mommies, you are pregnant, congratulations. But bleeding or spotting can actually shatter your dreams. I know it could be such a devastating symptom, but it is something very common, especially during the first trimester. And normally there's no cause for an alarm. It just happens. There could be very little spotting or maybe a little more. Sometimes this can be even mistaken as your period. So some girls do get confused. They consider this as their periods and they don't even realize they are pregnant. And remember one thing, the baby remains healthy. Bleeding in the first trimester. About 20% of women have some bleeding during the first 12 weeks of pregnancy. There could be a number of causes. Before 10 weeks, yes, there are little chances of miscarriages, but it generally doesn't occur after that. But yes, if the bleeding has occurred, it is definitely something to be concerned about. The first commonest cause of bleeding in the first trimester is implantation bleeding. Now, what is this implantation bleeding? You might experience some normal spotting within the first 6 to 12 days after you conceive. Because what is happening, your fertilized egg is getting implanted in the lining of the uterus, and some women don't even realize that they are pregnant, and this little bleeding is mistaken as a light scanty flow in the periods, and you might even miss out that you are pregnant for the next few days until you do a pregnancy test and some more symptoms appear. The second commonest cause of bleeding could be a miscarriage, because miscarriage is most common during the first 12 weeks of pregnancy. It tends to be one of the biggest concerns with first trimester bleeding. Though first trimester bleeding does not necessarily mean that you have lost the baby or you're going to have a miscarriage, but it is something that you should be alert about. When we do an ultrasound, about 90% of these women experience that the heartbeat is beating and the pregnancy is fine and there are no chances of miscarriage. Other symptoms of miscarriages are strong cramps in your lower abdomen and tissue passing through the vagina. So that is also a sign of miscarriage. Now the third, which is not very common but it does exist, it is ectopic pregnancy. Ectopic pregnancy could be life-threatening if it is an acute ectopic pregnancy. In this, the baby actually is growing in your fallopian tube, and this can burst and cause an emergency in which you can suddenly collapse. But so many times I've seen chronic ectopic pregnancies which are not that life-threatening. In this, what happens is little bit of spotting, dirty brown discharge keeps happening, and when you do a pregnancy test, the pregnancy test could be weakly positive, but there's another test that we do, it is called beta HCG, which confirms the pregnancy. And now when we do an ultrasound, generally a transvaginal ultrasound will diagnose the ectopic pregnancy and you will be treated according to that. Ectopic pregnancies generally land up in a surgery. Now other symptoms of ectopic pregnancy are cramps in the lower abdomen and sometimes even lightheadedness in case if the ectopic pregnancy has ruptured. Now fourth one, if you are bleeding, another very rarely we find something called a molar pregnancy. It is also called gestational trophoblastic disease. It occurs very rarely. Because what happens is the baby is not formed properly. Inside the tissues become like grapes, and when we examine our patients clinically, we find that the uterus size is bigger and it is very easily diagnosed by the beta HCG and an ultrasound. In this also spotting does occur. Now other symptoms of molar pregnancy are severe nausea and vomiting. This is a condition in which you might have hyperemesis gravidarum, that is even water or any amount of food that you eat will not be digested, and as I had said earlier, your uterus size would be bigger than the gestational size. Fifth, sometimes we even see cervical changes. During pregnancy, there's a lot of blood flow going to the cervix. So sometimes during an intercourse, or if you've done a pap test, that is a cancer screening test, if you're suspecting cancer, so getting in contact with the cervix can also trigger some bleeding. So this type of bleeding is something which we are not really worried about. 6. Infection. Pregnancy is an immunocompromised condition because the body has to adjust to the growing fetus, so your immunity is reduced. Because of this reduced immunity, you can have a number of infections in the body, more so in the cervix and vagina, and that can cause some amount of bleeding in the first trimester. Bleeding in the second trimester. Second trimester is considered to be very safe, but we do see bleeding in this trimester as well. What could be the possible causes? Infection is there. Placenta previa. In case if your placenta is low and the baby is on top, which is actually diagnosed in an ultrasound, you have to be careful. In this trimester, if you have bleeding, you must call your doctor as soon as possible, because this bleeding is not considered very normal. And if it is happening because of infection, or you've had an intercourse, that kind of an episode, and if you are bleeding after that, that is also negligible, very little. But giving that history to the doctor is very important, because we need to differentiate whether it is bleeding because of trauma or it is a painless bleeding. In placenta previa, depending on the grade, the bleeding happens, and that is basically a painless bleeding. That is one very important sign that we notice. Placenta previa is not very common. It occurs only 1 in 200 pregnancies. So just relax. Don't think you are one amongst those 200. And in the first trimester, when the ultrasound is done, they do show a low-lying placenta. Don't worry about that. In the anomaly scan at 20 weeks, when we do an ultrasound, that is the time when we finally judge how far the placenta is from the internal os, or whether it is covering. Placenta previa has different grades, grade 1, 2, 3, 4. Depending on the severity, we ask our patients what kind of precautions they need. So if you have placenta previa, complete placenta previa, only then we advise you rest and not to pick up heavy things, and those kind of precautions are taken. Another rarely seen thing is something called a placental abruption. It occurs only 1% of the pregnancies. The placenta detaches from the wall of the uterus before or during labor, and the blood pools between the placenta and the uterus. Sometimes the blood might trickle out, sometimes the blood remains hidden, which is a little dangerous for both the mother and the baby. Other signs and symptoms of placental abruption are abdominal pain, clots from the vagina, a tender uterus, and back pain. Uterine rupture is also a thing which is seen in India. It is very sad, but then it does occur when you are being mishandled by quacks. So it is very important you go to qualified doctors only for your delivery, because it is your life and your baby's life. When too many injections are given in the villages by quacks, the uterine rupture does occur. And another common reason is if you've had a previous cesarean section and this time you are being handled not by an experienced nurse or maybe a quack, then the scar can open up. So this can actually be very dangerous for your baby and for you. The sign in this is the uterus rupture will show pain in the abdomen. You might have some amount of bleeding as well. So this is a condition when you must rush to a higher center immediately. VASA Previa is another thing. It is a very rare condition. In this, the developing baby's blood vessels in the umbilical cord or placenta cross the opening to the birth canal. And VASA Previa can be very dangerous to the baby because the blood vessels can tear open, causing the baby to bleed severely and lose oxygen. Other signs of VASA Previa include abnormal fetal heart rate and excessive bleeding. The fetal heart rate will be very high or it will be very slow. Premature labor is also another thing which you have noticed, which causes vaginal bleeding. Vaginal bleeding late in pregnancy may just be a sign of your body getting ready to deliver. Sometimes what happens is the mucus plug may get discharged. So that is actually a healthy sign and sign of you going into labor. So if you're passing some clots or anything, then it is something to worry about. Otherwise, this small bloody show is considered normal. If bleeding and symptoms of labor begin before 37 weeks of pregnancy, contact your doctor right away because you might be in preterm labor. The other symptoms of preterm labor are contractions. You will have uterine contractions, you'll have vaginal discharge, and that abdominal pressure will be there, and you might have pain in your back as well. And there are a few very rare cases in which the bleeding might occur throughout the pregnancy. You might have some polyps in the cervix or even in the vagina, which can cause bleeding. Sometimes, very rarely, if you have pregnancy associated with cancer, also you might have some vaginal bleeding. So these are the conditions which are always diagnosed by your doctor by a number of tests, ultrasound and other tests. So please consult your doctor, and in case if you have bleeding of any kind, little or more, you must go and see your doctor. But remember, don't panic, because if you panic, that could be more stressful for the baby and there could be more complications to you and your baby. So in such times, what is important is to remain calm and composed and take action. So I would wish you a very happy pregnancy without any of these complications. For that, all you need to do is smile and stay relaxed. Thank you and namaste.